I couldn't believe that this kind of a program was even available. It's definitely extended my mom and dad's life, and it's probably extended mine too.
We derive satisfaction out of watching people being able to stay at home and live the last years of their life out in the community and the place that they want to be.
They don't push you aside. If you have a problem, they are there to take care of it.
They're just great. They're so caring. You can't believe how nice they are. It's just wonderful.
You know them more than just as a diagnosis, just as somebody that you're treating. And we actually become like a really big, huge family.
There's no sadness, there's only love, a lot of love there.
My life is totally different now that I have found PACE.
It's bright and early on a Monday morning, and Teresa Arsaga is raring to go. Until recently, though, she hardly ever left the house.
I have arthritis in my shoulders, arthritis in my knees. I couldn't walk. I was just sitting here in a nightgown. I didn't even bathe myself or take care of myself. I used to ask God to take me, that I want to die. I used to be very upset, very lonely and very upset.
But not anymore.
Buenos días.
Several times a week, a driver for the PACE program comes to pick up Teresa and take her to a PACE center where she'll spend the day.
Good morning, Paul. How you doing? My driver, he helps me. He puts me in the van. He puts us music. He said, what kind of music you like? So he say them way back. So he has the cassette. So everybody's singing. And then when we get there, we're here. Oh, we're very happy that we got in to our second home. We're very happy.
At the PACE Center, Teresa does crafts,
we follow what they tell us to do,
attends a meeting with social workers,
Thank you.
has lunch, and sees a doctor. The program serves older people like Teresa who need long-term care.
In a sense, it's a one-stop shopping model that gives them the opportunity to avoid fragmentation and doesn't let them get lost in the system of social services.
That's possible because of a team approach to care.
We went to visit her yesterday, and she told us that she felt better.
Several times a week, there's a meeting of PACE professionals, including a doctor or nurse, physical therapist, social worker, and transportation coordinator, to discuss the care of participants like Teresa.
She's being seen right now in physical therapy for her knee and also is riding the bike a little bit. Is there any problem with her continuing to do that while she's on the medication?
The care here is centered on a concept of a team making decisions. That group meets to review what happened yesterday, what's going to happen today, what new problems have come up on individuals the last night, what new things we have to take care of, how we have to adjust their plans of care.
And if you'll take some deep breaths with your mouth open, Shirley.
The care plans are comprehensive, encompassing medical treatments and tests, medications, rehabilitation therapy, social activities, meals, and help with the tasks of daily living. Thanks to physical therapy and social support provided by PACE, Teresa can now walk without pain, and her depression has lifted.
Oh, I'm so happy. I have a lot of friends, a lot of people that love me, and I like to fix myself now. Everything, you know. There's a lot of love. No, there's no sadness there.
We offer them opportunities that they wouldn't get if they were at home. So the PACE program, in a sense, it provides them the dignity that they've lost. It gives them the opportunity to become active in the community at their own capacity, and it gives them the opportunity to remain in a loving environment with their family as well as at the center as long as possible.
Services are most often provided at PACE centers where participants typically spend 2 or 3 days a week. But the PACE team also works with enrollees in other settings, such as hospitals and nursing homes. And they often visit participants at home. In Teresa's case, the PACE program provides a nursing aide several times a week to help her around the house.
She cooks for me. She helps me take a bath. She helps me a lot. I love her like a daughter.
That help, along with visits to the PACE Center, allows Teresa to continue living at home.
She's getting, I think, care that I wouldn't be able to do it on my own, even as hard as I could try. So it's a big relief on my part that I don't have to be constantly monitoring her during the day.
The PACE team also pays close attention to the needs of full-time caregivers like Bonnie Jensen. Her husband Stan suffered a stroke and lost the use of his right arm and his ability to speak.
I was getting pushed to a place where I don't think I was a very good caregiver. I got to be kind of grouchy, and I was crowded. I had all these decisions and all these things I had to take care of, and there just weren't enough hours. And now I have people helping me, and I didn't think there were people to help me.
That's a lot of what I do with her, is talking to her, affirming that she has needs as well as Stan, and helping her feel more comfortable meeting her needs so she can meet Stan's needs too.
The PACE program is financed by pooling Medicare and Medicaid funds. Participants not eligible for Medicaid pay part of the cost privately. PACE receives these funds as a set monthly per person or capitated payment.
You have to make the tip of your tongue go up behind your teeth. La.
In return, the program assumes full financial risk and provides whatever services are needed, including those that Medicare and Medicaid may not cover. For example, in other settings, physical therapy usually stops once a person reaches a certain point. Not at PACE.
Here, we're allowed to continue with the person and work with them in their maintenance program. So a person will achieve their goals of being independent and fall free, but they can still come in and use all the equipment in the gym and work with our staff, and we can keep a close eye on them and make sure they're still exercising and staying at a high level.
The team's freedom to be creative in meeting participants' needs sets PACE apart from other programs.
There's not paperwork to pass through, and there's no approval process from a higher group. It's all based on what individuals need. What is their need to keep that person living in the community? And that's how our decisions are made. That's on every level. The decisions are made at the level of those who take care of them, by the people who are taking care of them.
Tell me if you feel okay. If there's any, you feel bad, let me know.
The flexibility of PACE permits the program to do more for less money than it typically costs Medicare and Medicaid to provide care to frail elders. That's accomplished in part by keeping PACE participants healthier and out of hospitals and nursing homes.
It's well seated over.
Because the PACE team can respond rapidly to any changes in a person's condition, they're often able to prevent problems from becoming more serious. Close monitoring of participants' medication use also helps.
We even have them come in the center every day to make sure they take their medicines. And their medical problems, which used to be very complex, become very simple. And their medical issues become very much smoothed out. So they no longer are spending time in the hospital, spending time in the emergency room.
In addition, PACE participants can see a doctor as often as necessary without being rushed. Thanks in part to such individualized attention, satisfaction rates among PACE participants and their families are very high. So is the quality of care, which is constantly being monitored from both inside and outside the program. The emphasis on quality has helped spur the growth of PACE, which began more than 3 decades ago at Onlock Senior Health Services in San Francisco. Since then, dozens of other communities have adapted the model to meet the needs of their particular populations.
6 of the big ones.
And now the program has permanent provider status from the federal government, setting the stage for further expansion.
So we're now at a place where we can have PACE become a household word, so that it becomes an automatic thought and consideration when someone is in a position where they're seeking long-term care services.
Services that fill the final years of life with a sense of independence, dignity, and purpose.
All of them are beautiful, and I'm a very happy person.
It's just absolutely a wonderful program.